How are you feeling today?
Oh, good. Happy to see you.
Happy to see you as well. So you're in here for a full body woman's assessment.
Yes.
I see in the notes that you had just a little bit of nausea and you haven't been feeling the greatest.
I've been very tired and a little bit of nausea at night, yes. I have trouble falling asleep. I don't wake up very rested. And I also have a little bit of itchiness on my scalp. Some tummy ache as well. I've recently started eating more dairy.
Okay.
So I don't know if it's related to that. It could be.
Okay. Is there a reason for why you've changed your diet?
No reason. I just noticed that I happen to be craving more dairy recently.
Okay. All right. As far as being tired goes, have you changed up anything else? Do you exercise daily?
I do every other day, not daily.
Okay, very good.
So I've kept up my exercise level. I take walks every day. I am on my phone late at night, a lot. So I definitely have the blue light hitting my eyes well into the night.
Oh, okay. So tired eyes, I'm assuming as well.
Yes.
Do you suffer with dry eye at all?
I do get dry eyes, yes.
Okay. Do you have any family history of any diabetes or high blood pressure?
No.
Okay. When's the last time you had an assessment?
More than 6 months ago.
Okay, so you're definitely due for one.
Yes.
Have you been having any back problems?
Now that you mentioned maybe a little bit of backache. Yes, more so in the morning right after I wake up.
Okay, any joint pain?
No joint pains, no.
Have you had any injuries in the last couple months?
No.
Do you use tobacco or alcohol?
Alcohol, socially, maybe once a week at most. No tobacco. And nothing else.
And have you ever had difficulty breathing?
No.
Okay. All right, so have you ever had dry mouth?
No, I never noticed that.
Okay. Cracked lips?
Cracked lips, yes.
Okay. That can come with dry seasons like winter and fall. And do you drink at least 8 glasses of water a day?
No, nowhere near that. Maybe 4 to 6 at best.
Okay, we should probably increase the water.
Yes.
Do you drink a lot of caffeine?
Yes.
Okay.
I do espresso style.
Okay. How many espressos a day?
At a minimum 2, sometimes up to 4.
Okay.
I love coffee, yes.
So coffee, it takes magnesium out of your body. So I think a good idea would be to make sure that you are getting the minerals back in. So definitely increase the water. And just consume any electrolytes you possibly can, maybe Gatorade.
I do take magnesium supplements at night, right before I fall asleep.
Perfect. And if you add Celtic salt to your diet, that will really help. As far as today's assessment goes, I would like to do a full body examination. We'll focus on the scalp as well, see if there's something going on. Might need to change up your shampoo. Are you using drugstore shampoo right now?
I believe so, yes. I believe it's drugstore.
Okay, we might need to put you on maybe like a prescription shampoo to maybe get dry flakes off your scalp if you've had that.
Yeah, I do make sure that I buy products that don't have any harsh chemicals in them, so I pay attention to that. But maybe changing the shampoo could help, yeah. I'll definitely give that a try.
Very good. And as far as your abdomen, your stomach pains, are they frequent or just subtle every now and then?
Every now and then, I do feel a sharp shooting pain in my left side. So I definitely categorize them as medium to severe.
Okay.
But it goes away after a couple of minutes. If I just rest and I don't do anything.
I'm wondering if you might be intolerant to dairy. So let's go ahead and do an assessment. We'll start off with just checking your vitals.
This video is sponsored by Dossier, a company that sells premium quality, ethical, affordable perfume for all. Say yes to smelling good and no to overpaying.
I recently got a couple more perfumes from Dossier because I love them so much.
Dossier sent me their floral honeysuckle inspired by Gucci's Bloom, which goes for $108. Dossier only charges $39 for the same exact smell. I also got the Ambre Vetiver, a deep and mysterious unisex smell that has notes of lemon, bergamot, orange blossom, and violet. I also got the Fougère Oud, inspired by Tom Ford's Oud Wood, which retails for $263. Dossier replicated the smell perfectly for only $39. Here's the aromatic pineapple scent, a tropical fun in the sun smell for him that has notes of ginger, pineapple, sage, and amberwood. It smells delicious. I was also sent a floral honeysuckle room diffuser, which releases a soft and feminine smell in my filming studio.
Just head on over to their website, dossier.com, and check out the sales currently going on. You will get premium products at incredibly affordable prices.
I have my stethoscope here. I just start off by listening to your heart and your lungs. Just going to stick that right there. Okay, I'll have you breathe normal. Take a deep breath in and release. We'll do that again. Very good. I'm just going to listen with the bell. Your heartbeat is strong. I'm hearing S1 and S2, no S3 or 4, no heart murmurs. Very good. Going to check your temperature, and I'll just be putting this in your ear. Okay, very good. 98.2. Let's check your oxygenation. Okay, oxygenation is 89%. Very good. And now I'll check your blood pressure. Have you ever had your blood pressure checked before?
Yes.
Okay. Just slide your arm in here. And your legs are uncrossed. Just breathe normal for me. You don't have elevated blood pressure. It's 119/78, which is completely normal. I was thinking maybe you might have an elevated blood pressure because you've been so tired, but it doesn't seem to be the case. Go ahead and put our gown on.
Okay.
It's clean and ready for you. Once you're comfortable, feel free to lay down and we'll get started on the next part of this medical exam.
Awesome.
Is it all right with you if I unbutton the gown?
Mm-hmm.
Alright, I'm just going to start off by doing a very light palpation. Let me know if you feel any discomfort at all. Okay, I just heard your stomach a little bit, which is good. Hearing sounds. Just going to lightly tap. I'm going to start off by doing a measurement of the length of your abdomen here. It's about 8 inches long. And about 10 inches wide. And the belly button is half an inch wide on all sides. So we have a normal looking belly button for sure. Size-wise, and I'm going to use my light to take a look inside. It's clean. No scabbing. You don't appear to have a belly button piercing. And I'm just going to double check those measurements here. 2.3, 2.3. Let me check the belly fat percentage here. 1 inch. 1.2. 1.2, 0.3, 0.4, 0.5, 1.3, 0.2. Okay, very good. And then I will check the diameter. 2.3, 1.4, 2.3, 0.4, measuring from the belly button to the top of the stomach, which is about 5 inches on both sides. Measuring the uterus, which is about 8 inches. And the stomach, about 8.5. Just going to palpate with my reflex hammer. We're having no skin reaction. I'm going to run a cold object down your abdomen. Just tell me when you don't feel it anymore.
No. No. No.
I'm going to create a vibration and just say yes when you feel it.
Yes. 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 Yes.
Very good. I'm going to poke you with 2 prongs. This is what it feels like. Or 1 prong. This is what it feels like. Say 1 or 2.
2. 1. 1. 2. 2. 1. 2.
move on to the sharp or dull test. This is dull, and this is sharp. Let's get started. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Very good. I'm going to add in cold as well. This is what it feels like. Okay. Cold. Dull. Oh. Sharp. Cold. Sharp. Dull. Cold. Dull. Sharp. Dull. Cold. Dull. Sharp. Dull. Good. Say yes when you feel the soft brush. Yes. 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 Perfect. I'm going to close the gown. Then we'll move on to your feet. Going to start off by having a look at your soles here. I see just a little bit of skin coming from the bottom of your foot. This is completely normal. It can happen to anyone. Starting off with a light palpation on the soles of your feet. They are normal to touch in temperature. I do see just a little bit of skin that's coming off of the bottom of the foot here. To see if I can scrape it off. Okay, it doesn't look like it wants to come off. But a little bit of skin loss at the bottom of the foot is quite normal. We do walk on our feet every day. I do see you do have Just a little slight scratch here. It doesn't look inflamed or anything though. Does that feel uncomfortable at all to touch?
No.
Okay, we have a little bit of skin loss here as well. It doesn't appear to be loose. Skin temperature is normal to touch. Let me measure your feet. About 8 inches. Is your shoe size 8?
7.5.
Okay, that makes sense actually. Okay, we do actually have a 7.5 measurement. Very good. On this side as well. And the heel is measuring in at 3.4. 3.4 and a half. 3.4 and 3.4 and a half. 3.4, 4.2, 5.2, 3.2, 5.3, 3.5. The width is 4.5. Toes about an inch long. You measure the toes with my smaller device here. Three. Point three. Point four. Three. I'm going to put a cold sensation on your legs and just to say stop when you don't feel it anymore.
Stopped. 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 Stopped.
On the soles of your feet.
Stopped. Stopped. Now. Now.
Going to use 2 prongs or 1 prong on your legs. That's 2, and this is 1.
One. 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 2. 2. 1. 1.
I use it on your feet as well.
2. 1. 1. 2. 1. 2.
Now I'll be doing a sharper dull test on your legs first. This is dull, and this is sharp.
Sharp. Dull. 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 Sharp. Dull.
We're doing sharp, dull, or cold now. That's cold.
Sharp. Cold. Cold. Dull. Sharp. Dull. Dull. Sharp. Cold. Dull. Cold. Sharp. Dull. Dull. Dull.
I'll be using my reflex hammer. Check for circulation and blood flow. And I don't see too much of a reaction, which is actually normal, so that's good. Say yes when you feel the brush.
Yes. 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 Yes.
I want you to say yes when you feel the light scratch.
Okay. Yes. 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 Yes.
Is it alright with you if I unbutton your gown?
Yes.
I'm going to start off by having a feel of your spine. Any discomfort
No.
by your lumbar? Take a look at your skin. See just a few moles here. Have you ever had them checked for melanoma?
Yes.
And were they clear?
Yes.
Okay,
I have to get them rechecked every 6 months or so.
okay, very good. Do you see one here as well? It's not raised, so that's good. And a little one right here. Skin is fairly clear. There's no discoloration. Going to check the body fat percentage of the back. Point 2.4, 0.3, 1.5, 1.4, 2, 4, 3, 4, 5, 3, 2, 5, 3. Going to measure the spine. 15.4 inches long. To measure each vertebrae. Shoulder. Medial shoulder blade. 7.3, 0.5, 0.3, 1.2, 3.4, 0.2, 0.3, 0.4, 1.5, 1.6, 7, 2. I'm going to run a cold object down your spine, and I want you to say yes when you don't feel it anymore.
Yes. 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 Yes.
I'm going to spray a little bit of water on your back, and then we'll do some cupping. had cupping before?
No.
It'll really help release some of that tension that you have. You said you had some back tension, right?
Yeah. My upper back.
Okay. You really should feel quite a bit of release with this cupping therapy.
Feels good, yes.
Just going to wipe that water off. Going to move on to sharp or dull. This is sharp. This is dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull.
I'm going to incorporate cold as well.
Dull.
dull, sharp, cold.
Okay. I'm going to close the gown. Going to move on to checking your axillary and bacterial lymph nodes underneath the arms. And if you could just raise this arm for me. Very good. Just going to have a feel of the lymph nodes, checking for lymph node enlargement. Not finding any abnormal abscesses or lumps of any kind. Go ahead and bring your arm down. We'll check the other side. Just going to check to see if we find any abnormal abscesses on this side here. Not noting any enlargements in the lymph nodes. They are fairly normal in size, and I don't see any inflammation. Good, we can bring that arm down. How are you feeling?
Awesome. Thank you so much for all of the attention.
Wonderful. So I don't see anything specific popping up that I should be concerned about. I think you really just need to hydrate and drink that water and get the electrolytes and Celtic salt in your system. You'll have more magnesium and minerals, and I think that will really help with how tired you've been feeling.
Sounds good.
Other than that, your scalp looked good as well. I think what we could do is maybe just switch up the shampoo and see which one might work best for you. Maybe a 5.5 neutral one, maybe not too alkaline. Since your scalp is a little bit more on the acidic side, I would look for maybe a pH neutral shampoo.
That's a very good idea. I'll do that.
Awesome. Well, you have a wonderful rest of your day. Thank you for coming.